Hello, my name is Jordan Thomas and I'm going to be talking about altered sensory perception. The eye is a fascinating structure because it receives light and transmits that nerve impulse to the brain where an image is formed. The eyeball is round and is protected by the bony eye socket of the skull. The eyeball is made up of the sclera, uvea, and retina. The sclera is the outermost layer of the eyeball. This white, fibrous connective tissue is responsible for keeping the eyeball round and protecting the eye from injury. The sclera is covered by conjunctiva, which lubricates the eye. Muscles also attach to the sclera to move the eye. Under the sclera is the vascular layer known as the uvea. This pigmented layer provides the retina with oxygen and nutrients. This vascular middle layer is made up of three parts: the choroid, ciliary body, and the iris. The choroid is the vascular layer of the eye lying between the retina and the sclera, where the ciliary body is found behind the iris, containing muscles that help change the shape of the lens and make the aqueous humor. The retina is the most inner layer and posterior layer of the eye, and it contains light-sensitive nerve endings known as photoreceptors. These photoreceptors convert light that enters through the cornea into electrical signals to the optic nerve that is sent to the brain to create an image. At the center of the retina is the macula, which is known as our central vision because it processes clear and straight vision. Next we have vitreous humor and aqueous humor, which is the fluid within the eye. The vitreous humor fills the eye posteriorly up to the lens, and this fluid maintains the shape of the eye and helps light pass through the retina. While the aqueous humor fills the space in the anterior portion of the eye between the lens and the cornea to keep the eye in a pressurized state. The aqueous humor is produced by the eye and provides nutrients to the eye. In the posterior part of the eye, there is an optic disc, which is where there is no light-sensitive receptors to respond to light, because this is where the octave nerve connects to the retina, and it serves as a blind spot. The octave nerve is where electrical impulses are sent from the eye to the brain to process sensory information so we can see images. Like mentioned earlier, the cornea is at the anterior surface of the eye, and it is a curved, transparent structure in front of the lens. This is where light first enters the eye, then through the lens, which is a transparent biconcave structure composed of protein. Zelman, 2014, page 322. The lens job is to focus the light onto the retina, but in front of the lens lies the iris, which is the colored part of the eye, and its structure is seen as a flattened disc with a central opening called the pupil. Zelman, 2014, page 322. As light passes through the pupil to the lens, the iris will change the diameter of the pupil to adjust the amount of light entering the eye. Lastly, we have the eyelids, that are skin-covering flaps that can close and protect the eye's surface. Tear glands are used to secrete lubrication fluids onto the outer surface of the eye. The three most common eye diseases in older adults are age-related macular degeneration, glaucoma, and cataracts. Macular degeneration is a reduction or loss of acute vision, and it is common and leading cause of vision loss in adults. This disease affects the central part of the retina with the highest density of photoreceptors, and part of the form sharp image but leaves peripheral vision intact. There are two different forms of macular degeneration, such as Autotrophic and exudative. Autotrophic is a dry form comprising of more than 90% of cases, while the exudative is a wet hemorrhagic type, resulting in more destruction. In the dry form, the macular area degenerates, while the wet form has capillaries growing under the macular link and disrupts the macula. It is known that obstructed blood flow followed by revascularization damages the area to the retina possible for acute vision. Other contributing factors are injury, inflammation, infection, and hereditary. Risk factors include age, family history, and smoking. Typically, this occurs after age 50. Signs and symptoms include inability to see faces clearly, difficulty reading, and problems performing close work such as sewing. Diagnostic requires a dilated eye exam with an ophthalmoscope and an Amsler grid composed of a grid of fine lines can direct disoriented, incomplete, or wavy images in the central vision field. Fluorescein angiograph using a dye injected intravenously and a special camera reveals leaking vessels below the retina. Unfortunately, there is no cure for the macular degeneration. It cannot be prevented, but some reduction of wet macular degeneration can be achieved with laser surgery. Vitamin supplementations may help slow dry macular degeneration. Some patients may get surgical implants of a telescopic lens can improve central vision. For this disease, I would tell my patients to get tested since it is hereditary. Since smoking is a risk factor, I would encourage my patients not to smoke and to go to regular eye exams each year. Next, we have glaucoma, which is where there is an increased pressure within the eye, which is painless. The increased pressure damages the optic nerve, which is the leading cause of blindness. The risk for glaucoma is highest among individuals who are older than 60, especially Mexican Americans, and over age 40, especially African Americans. Family history also increase the risk factor. Signs and symptoms are not noticed until vision loss occurs. The diagnosis of glaucoma includes tonometry, which measures intraocular pressure. Visual fields testing measures the field peripheral vision. Corneal thickness can cause high pressure readings in people who do not have glaucoma. Pachymetry, which measures the thickness of the cornea, prevents this kind of misdiagnosis. Treatments for glaucoma are aimed to lower the intraocular pressure and include medications and laser surgery. Medication eye drops reduce the production of fluids and promote fluid drainage. Laser surgery involves piercing the anterior chamber with a laser beam to promote drainage and reduce pressure. There is no cure or prevention, and the damage to the optic nerve cannot be reversed. Early detections allow for early treatment to prevent serious damage. I would encourage my patients to do a regular eye exam and evaluate the intraocular pressure to help decrease the risk of glaucoma. Patients need to monitor and manage their blood sugar levels and hypertension to help prevent glaucoma. Lastly, we have cataracts, which is clouding of the lens. Cataracts is related to aging, and it is seen that by age 65, almost half of all Americans have some degree of cataract formation and resulting impaired vision. After age 75, the figure is close to 70%. Zellman, 2014, page 326. Risk factors can include trauma, smoking, alcohol use, exposure to radiation or ultraviolet rays, synthetic diseases such as diabetes or hypertension, poor nutrition, and infections. Symptoms depend on the extent of the lens cloudiness and if it is in one or both eyes are affected. Age-associated cataracts occur in both eyes. Due to the cloudiness, there are visual impairments including visual distortion, blurred vision, glare especially in bright light or when driving at night. In early development stages of cataracts can be seen through a dilated pupil with an ophthalmoscope or slit lamp. As the cataracts continue to develop, the retina becomes more difficult to visualize and the pupil develops a white discoloration. Diagnosis can be accomplished in a routine eye exam, and early detection allows for time for treatment and prevention measures to reduce the progression. There is an outpatient lens replacement surgery that has become a routine procedure, and vision is restored in 95% of patients. I would tell my patients to go to regular eye exams, especially as they get older, and avoid drinking, tobacco use, manage their diabetes and hypertension, have a well-balanced diet, and avoid infections and radiation. Overall, our eye is important to take care of. So it is important to go to routine eye exams yearly, especially as we get older. Thank you.